All right, today let's talk about some ankle mobility because yours probably isn't too great. A lot of times when the ankle joint, the talocrural joint is stiff, other places start to compensate. A lot of times we get the foot to pronate a little bit too much. That can cause some plantar fascia type symptoms. The knee and the hips start rotating in. That can give you some hip pain or some medial knee pain. So what we want to do is look at how that talocrural joint moves and then do a mobilization to try to improve that. Now, a lot of times what I see is a functional dorsiflexion ankle mobility test, and I want to go over that real quick, show you it so that you can use it, but understand that there's limitations with it. A test is only as good as the amount that it tests what we want to test. So if it doesn't test exactly what we want, the validity kind of decreases. So that's what I have, that's the problem I have with this test. So real easy. What you do is you put a box in front of you, put your foot down, and try to get the knee all the way to the box. So right in here, I can hit it. And we think, okay, cool, pass the test, that's exactly what we want. But look a little bit closer at the foot and the ankle. When we lean forward, we're not only moving through the talocrural joint, that ankle joint, but we're also collapsing into that pronated position. And that's really going to test if the foot and the ankle together can move into that dorsiflex position. That's not necessarily a bad thing, so definitely do this exercise. But we want to be a little bit more specific to the talocrural joint. I don't have a great exercise or a great test for this that you can do yourself. The way I do it in the clinic takes 2 people to do. So we want to stabilize this joint and see if the knee can still move. To do it at home, try to keep that arch up. See how much difference you have. So right there is much different than there. You see that difference is the arch isn't moving, I'm stabilizing the foot, just checking the talocrural joint. Then when I collapse in, I'm able to move a lot further. So that's your test. If you want to do it, go for it. If not, go in and get an assessment, see if your ankles are moving as well as they should. But as far as the mobilization, what we want to do is get the talocrural joint to stay still and get the tibia and fibula to come over the top. So we're going to do that with a band. So grab a band, make sure it's securely attached behind you, and get a box. So you can do it on the floor, but it's a lot easier to do it on a box. The band's going to come around your ankle. Then I want you to step up on the box. Now, a very important part of this is that we want to make sure that the band is actually on the talus, not on the shin. If it's all the way up here, it's not really going to do too much. We're just doing some lunge exercise, I guess. What I want you to find is that soft spot, and then put the band just below that, right in there. So it should be nice and tight. You should feel that pressure from the band. What I want you to do is drive the knee over the foot. So coming in here. Best as you can, keep that arch built. Make sure you're not collapsing in. Make sure the knee is not driving out. I want that knee to go straight over the toes. When you're at the end range, oscillate a little bit. You should feel a pinchy sort of stretch in the front of the ankle. Okay, so there you have a banded mobilization for the talocrural joint. Again, with the band, you can't be super specific. I like using my hands. I like getting in there and mobilizing the joint. But when you're needing something to do on your own, this is a great way to do it.